Good day everyone, I am Kaiser Angelo Gavino from BSN 2A. For today's video, I am going to perform the fundal height measurement, Leopold maneuver, and auscultating fetal heart rate. Before doing all the procedure, we need to identify and explain the plan and procedure to the client. The rationale of doing this is for us to verify we're handling the right patient and for order to her to have awareness what we are going to do. For the first step, we need to wash our hands and do the proper hand hygiene and observe the other infection control to the procedure. The rationale is doing this to prevent spreading of microorganisms. For the second step, we need to provide the client privacy. The rationale of this is for the patient to be comfortable while we are doing the procedure. For the third step, we need to prepare all the equipment that we will be needed. The rationale of this to save the time and effort. So, the first is the fundal height measurement. The rationale of doing this procedure is to assess the growth and the development of the fetus. The equipment that will be needed is a tape measure in order to measure the fundal height. So, let's go now to the implementation proper. First, provide the client privacy and do the hand hygiene. Next, introduce yourself to your client. Like this. Good morning, ma'am. I am Kaiser Angelo Gavino, a student nurse from NUST. I will be your student nurse for today. Ma'am, today, we will be going to have a fundal height measurement. It will not hurt you as well as your baby. And it's just to take a short period of time. It is okay for you, ma'am? For the first step, we need to position our client in a dorsal recumbent position and instruct our client to relax. Next, we need to expose the womb of the mother and get your tape measure. In measuring, we will be having the centimeter, place it on the superior edge of the pubis up to the top. The measurement and the weeks that the woman is pregnant should be equivalent. After that, we document all the data that we gather and place your client to the comfortable position. And now, let's go the Leopard's maneuver and the auscultating fetal heart rate. The rationale of doing this is to determine the baby position as well the heart rate. And doing the labor's maneuvers, we need first to obtain the client obesity. We need to determine the client vital sign, LMP, and the AOG. And the equipment that will be needed is stethoscope or Doppler if it's available, and watch with the second hand. First, provide the client privacy and do the proper hand hygiene. Next, introduce yourself to your client. Good morning, ma'am. I am Kaiser Angelo Gavino, a student nurse from NUST. I will be your student nurse for today. Ma'am, today we will going to have a Leopard's maneuver and auscultating fetal heart rate. It will be okay to your ma'am? First, we position our client in the recumbent position. Next, expose the womb. And for the Leopard maneuver, we check where the baby head or a back. For the first maneuver or the fundal grip, we need to position our hand to the triangle position and place it on the top of the womb. For the second maneuver or the umbilical grip, palpate the side of the uterus. Hold the Leopold's in the stationary of the left side of the uterus while the right hand palpate in the opposite side top to bottom, and hold the right hand to steady and palpate the left side to the top to the bottom. It is important to us to know where the baby back because this side has the most accurate fetal heart rate. For the third maneuver or the Paulick's grip, gently grasp the lower portion of the abdomen, grabs above the synthesis pelvic between the thumb and the index finger. Determine any movement and whether the part it is firm or soft. For the fourth maneuver is the pelvic grip. Facing to the foot part of the client, place your finger on the butt side of the uterus. And now, we auscultate the fetal heart rate of the baby. Feel and hear the heart rate of the baby. Take note, the normal heart rate of the baby is 120 to 160 beats per minute. And now, this is how to check your patient: the fundal height measurement, Leopard's maneuver, and auscultating fetal heart rate. I am Kaiser Angelo Legamia Gavino, a student nurse from Nueva Ecija University of Science and Technology. Thank you for watching!